Here's your Forbes Daily Briefing for Tuesday, May 21st. Today on Forbes, this $2.2 billion startup's GPT-4 powered AI bot demystifies health insurance. Glen Tullman believes telehealth, as we know it, is dead. The future, according to the venture capital investor and serial entrepreneur, is not video-based, but text-based. He estimates that in 3 years, 80 to 85% of all telehealth interactions you have with your doctor will be written. He told Forbes, quote, "All of the virtual care we're doing now is all going to move to chat." It's a bold prediction from the same man who sold his last company, Livongo, which made managing diabetes care easier, to telehealth giant Teladoc for $18.5 billion at the dizzying market highs of 2020. Now, Teladoc has a market cap of just over $2 billion, which Tullman blamed on, quote, poor leadership and a high-cost, labor-intensive structure due to the demand of staffing video visits. He said that text-based care and insights, with help from the latest advances in generative artificial intelligence, will cause a, quote, titanic shift. Now, he's teasing a new AI chatbot built on the same technology that powers ChatGPT, as part of his latest venture, called Transcarent, which announced a $126 million Series D at a $2.2 billion valuation earlier this month. The bot will aim to answer the health insurance-related questions that regularly stump more than half of Americans, like, how much will I have to pay for this doctor's visit? What's my deductible? Can you help me find a doctor? It's part of Transcarent's goal of becoming a one-stop shop to help average Americans navigate the opaque and oftentimes infuriating $4.5 trillion U.S. healthcare system. Transcarent, which offers an app with 24/7 chat-based primary care services, lower-cost drug options, referrals, and second opinions, has raised $450 million since its founding in 2020 from investors including Tullman's firm 7Wire Ventures and General Catalyst. It also works directly with health systems to get better rates for major health events like surgeries or cancer care. But experts say Transcarent's business may be more of a band-aid than a panacea, even though there is a growing market to help people navigate how to find and pay for healthcare services. Grandview Research estimates that market is worth $10 billion. Ji Bai, a healthcare accounting and policy professor at Johns Hopkins University, told Forbes that the only reason this opportunity exists is due to the dysfunction of the U.S. healthcare system. Bai said, quote, "It exploits a structural weakness of the current healthcare system, which is extreme complexity and the information disadvantage of patients." She added that navigation services are more of a, quote, tweak than a, quote, fundamental change. But there's so much waste in the system that, quote, even a small tweak can still make a difference. Most healthcare navigation services depend heavily on human call centers, which have high labor costs. That's where Tullman sees the greatest potential for his new AI tool, to cut the cost in half. The bot is currently built on top of OpenAI's GPT-4 large language model and includes in-house specialized models that can determine if a user has asked a medical question or is experiencing an emergency, at which point a human needs to take over. Tullman said companies are currently paying $10 to $15 per employee per month for human-based navigation services, while he plans to offer them for $5. Tullman said, quote, "This is truly a generational step. We've gone from boring navigation, which wasn't really interesting, to one place to get all of your care." Transcarent will start offering the tool to its customers in January 2025. Those customers are largely employers, as Transcarent is targeting a specific type of health insurance, self-funded plans. Around 134 million Americans receive health insurance benefits through their employer. In trying to crack this market, Tullman is facing off against a mix of startups, such as Carum Health and Included Health, and incumbents, like Quantum Health and publicly traded Accolade Health. For full coverage, check out Katie Jennings' piece on Forbes.com. This is Kieran Meadows from Forbes. Thanks for tuning in.